And AI just outscored doctors on clinical guidelines. Not by a little, by a statistically significant margin.
Okay. I'm sorry. What? We're just opening with that?
We're opening with that. Google's AMIE research just dropped in Nature on June 17, 2026. And the headline is exactly what it sounds like.
Nature. The journal. That's not some random preprint. That's the real deal.
That's the real deal. So here's the setup. Google took their AMIE system. It's built on Gemini, uses its long context capabilities, and they put it head-to-head against 21 primary care doctors.
21 actual human doctors.
Across 100 multi-visit cases, blinded study, and AMIE didn't just match them. It scored significantly higher on plan preciseness and guideline alignment.
Stop. Significantly higher. That's not a rounding error.
That's not a rounding error.
Okay, so walk me through this because I want to make sure I'm understanding. They're not testing it on real patients, right?
Right, and this is where it gets interesting. Both AMIE and the other AI we're going to talk about, they were tested exclusively on simulated patients. Text-only case notes, no physical exams, no stethoscope moments.
So it's reading charts.
It's reading charts. Very sophisticated charts with multiple visits baked in, but yes, the long context thing matters here. It can hold the whole patient history in its head at once.
Which, I mean, okay, doctors are human. They forget things. They're tired. They have 12 patients waiting.
Exactly. And that's where the precision gap starts to make sense. AMIE doesn't have a bad Tuesday.
It doesn't have a bad Tuesday. Honestly, that's kind of terrifying and comforting at the same time.
Both. Simultaneously. But here's the thing I want to hold on to for a second. There's a catch buried in this story, and it's a big one.
Okay, you can't just wait, no. Tell me about Mira first, because there's a second AI in this story, and I feel like we're burying it.
We're not burying it. Okay, so Mira is the other one. Different team entirely. Developed at TUD Dresden and Heidelberg University, among other institutions.
Germany's in the chat.
Germany's very much in the chat. And Mira's doing something almost incomprehensibly large in scope.
How large?
It can select from more than 85,000 options. Tests, prescriptions, hospital admissions. 85,000.
85,000 options. Okay, I need a second.
Take your second.
That's more decisions than I make in a year, in any domain.
And here's where Mira really earns its headline. Across more than 500 emergency department cases, it hit a diagnostic accuracy of around 87 to 88.9%.
Okay, and the doctors?
A panel of 6 doctors, around 78%.
78% against almost 89.
That's a 10-point gap in emergency medicine, where the stakes are. I mean, you know what the stakes are.
That's not a gap. That's a canyon.
It's a canyon, and both of these papers are in Nature at the same time, same week. That's not a coincidence.
That feels coordinated, like someone's making a point.
Or multiple research teams all hit a threshold at once, which might actually be more unsettling.
Hold on. You said there was a catch earlier. You dangled it.
Okay, so independent experts looked at the AMIE study and flagged something real. AMIE was specifically rewarded for following clinical guidelines. That's how it was evaluated.
Right.
But doctors aren't strictly bound to follow guidelines in the same way. They use judgment. They weigh the individual patient. Sometimes the guideline doesn't fit.
So AMIE got graded on a test it studied for.
That's basically it. The comparison might be lopsided because the scoring system favored exactly what AMIE was optimized to do.
Okay, I want to push back on your pushback though.
Push away.
Because Guidelines exist for a reason, right? If a doctor is consistently deviating from guidelines in ways that lower their score, maybe that's worth knowing about.
Hang on. I hear you. But medicine isn't a rubric. The patient in front of you has a life and a context, and
No, totally. But AMIE still matched them on overall management reasoning. That one to category where it won on a technicality. That was a genuine tie.
okay, yeah, I'll give you that. The management reasoning result is harder to dismiss.
And then it went further on the medication decisions piece. The benchmark for tricky medication calls, AMIE outperformed the doctors there too.
Which, if you think about drug interactions and dosing, that's precisely the kind of thing a system with perfect recall should be better at.
Right. It's not guessing. It's pattern matching at a scale no human brain can do.
Although, and I'm not done being skeptical, there's one more thing that deserves airtime. Both AMIE and Mira are running on base models that were already considered outdated at the time of publication.
Wait. What?
Already outdated. The models they used for the study. By the time the paper printed, newer versions existed.
So we're impressed by the old version.
We're impressed by the old version.
That's insane. That means the current version is just sitting there, being better, unscored.
Waiting for the next study.
Okay, so where does this actually go? Like, what are we watching for next?
Real patients. That's the wall. Every researcher involved in these studies is very careful to say, this is simulated, text only, no physical exam. The question is, when and how you bridge that to the clinic.
And who's liable when it's wrong?
That's the whole game, isn't it? The AI gets a score, the doctor gets a lawsuit.
Dark, but accurate.
The other thing to watch is regulatory. If an AI is outscoring doctors on guideline alignment, at some point a payer or a regulator asks, why isn't this in the workflow?
And that's where it stops being a research paper and starts being a policy fight.
Which is a much messier story than 87% accuracy.
So the short version is, two AIs just beat or matched doctors in major studies published in Nature. One of them does it across 85,000 possible clinical actions, and they were running on models that are already out of date.
That's the short version.
We're going to look back at this week and realize something shifted.
I think we might already be looking back at it.
Okay, that's a wrap on today's story. If this one got your brain going, share the episode. Seriously, send it to someone in medicine or someone who argues with you about AI. This is the conversation worth having.
Subscribe wherever you get your podcasts. We're back tomorrow. Don't be late.
Don't be late.